Good evening, everyone. I'm Christine Reed, the Nutralysis Director of Support and Marketing. Josiah Bryan, our Director of Programming, and I will be moderating tonight's System Strength Analysis Muscle Testing webinar with Dr. White. We are delighted to be able to offer this training to our clients and those in the nutrition community. What important work you all do. Since we've nearly reached maximum capacity on registration, we see that this is a pertinent topic indeed. Dr. Stuart White of Whole Health Associates in Houston is well known in the nutrition field for both the large successful practice he has, but also for his ability to teach, train, motivate, and mentor others in the community. He started out as a traditional chiropractor in 1980 and for 6 years focused on that. He began to realize that severe cases he was seeing required nutritional intervention. After he moved to Houston, he started out with standard processed supplements and only 201 herbals with MediHerb. He began taking nutrients and found that they worked for him and his health changed for the better. At that point, he realized that there was a lot in this for other people and his practice needed to change. In 2005, they began to add many other products. Since 1980, he has seen over 38,000 patients and teaches seminars throughout the country. His desire to help practitioners practice with intuitive techniques backed by therapeutic rationale. What we do and why we do it. He teaches because he loves to teach. It makes him a better practitioner, and he wants us to experience what he has experienced. He has a firm belief that those in the nutrition community desire to be better practitioners and desire to be able to help more people. Dr. White, thank you so much for coming to share with us this evening. And now I would like to turn this webinar over to you.
Okay, thank you very much, Christine. Thank you, Josiah. Thank you for the opportunity to do this work. Thank you, God, for the opportunity to do this work. It's really wonderful that we have this chance to study this and to further this work. I'm excited because this is my favorite thing I've done for the last 30 plus years, and I devoted my life to it. And sort of after a while, you put up your head and go, "This is what I've done with my life. This must be what I care about," which couldn't be more accurate. I mean, it's very true. So I had a really great day in practice together today. How about you guys? Did you see some amazing cases that sort of inspired you? I saw a young girl today. I'm sort of strange because I don't remember people for the first 3 months, and then I can't forget them, which is the other side of the problem. But I don't remember people until they really graft into me to do the work, the transformative work that we're going to do. But this little girl came back. It was her first time back. Her name was Kelly, and she had these horrible, horrible menstrual cramps before that. She'll be ready in a minute, Tony. And I had a really hope that she would get better, and I put her on some nutrients. Well, she came back today. She was so happy. Her mother came for her appointment, and Kelly came with her, and Kelly just came in and said, "I had no cramps. I feel fantastic. I've lost 6 pounds." I mean, she was literally beaming, little 18-year-old, just full of joy. And of course she should be, because the reality is she's excited that life is happening, and I'm so happy for her. And she had cramps just mildly at one point in time. She took some Calamo, which is what we gave her in case the cramps were there, and within 15 minutes they were gone, and she just feels like she's in control now. And she's really been committed to the low carbohydrate diet. She is nailing it. She's just going for the moon. And she's really, really dropped 6 pounds. Looks like she's dropped 10 to 12 pounds. I mean, it's all shape. She's going to blow us away, really, at 18 years old, very attractive. So what I propose to do tonight as a starting place, which just happens to be a coincidence, I have my patient who I was just finishing with named Gloria, and I could have ripped her off and just, finished really fast with her. But I just suddenly decided that, hey, I can do this, and I can enter the data in front of you on this screen while I'm talking to Gloria here, and you can actually hear me finish with a patient. So I thought it might be useful as a way of introducing the work, and then Gloria is going to go out the door, and then I'm going to teach the system strength analysis to you guys, so you might be able to use it. So I hope that's good for you. I hope that you like it, and I hope you don't feel like it's inappropriate. But I just suddenly realized that, why not just let it all blend together? So I'm going to
That's nice
go on our...
Dr. Really appreciate you suggesting that. I wanted to make a note for everybody listening to Dr. White that we will have time, I will try to make time at the end of the call for questions and answers. So as you're listening to Dr. White, as he's going through his presentation with Gloria and then teaching after this, note on the GoToWebinar box that's on your screen, there's a section for questions. So please go ahead, write your questions in while he's speaking, and we'll try to get to all of them or as many as we can after Dr. White's done teaching. Thank you, Dr. White.
Okay, great. Thank you. And Josiah, please interrupt anytime you want to. Josiah is going to also be helping us out with certain insights into the Nutralysis program, which one of the reasons we're using this as a teach module is that the Nutralysis software gives you prompts which basically can help you mimic what I do in practice. And it actually helps me mimic myself. And it helps me do it so well that I stop missing things. I start having better notes, better procedures, and it actually has accelerated my process to some degree, I've found. But so anyway, that's the exciting thing. The exciting thing for me, just as at the outset, I want to tell you that I feel like this software is an opportunity for me to write a book. And while we have some great new additions to the software as of last night, and the software is very mature in itself. It's still, working out its kinks. It's still developing. We're still working on it. And one of the things we're not entirely finished with, which we will be at some point in time, is all the protocols for all the weaknesses, which basically is my excitement of being able to get those protocols. And that's for free for all of you to have that subscribe to this. I'm really excited about being able to give that away, because in a way this is a book being written by me. And I'm really grateful to get it down, because I've just had too much results in practice to squander the information and not share it. So it's meaningful to pass it on. So this is Gloria up on the screen in front of you that you guys are looking at. And we're going to basically go to her system strength analysis study, and we're going to do a little bit of work there. Let's see if we can go find it. So here it is from today, yeah. So we'll go to her strength analysis, and I didn't really complete it, I just started it to get started with it. So we started off with a weakness in the hypothalamus. We found it to be positive. It showed that it was strengthened by something we work with for an infection, and that thing that strengthens it was called hisonol. So it's a form of hyssop. So now we're basically supporting the immune system. She's dealt with a lot of immune burdens over time, and so I won't tell all of her details, but she's sitting in the background saying she doesn't care, but I do. So anyway, she's just dealing with some immune burdens, and so we're going to go through this sequential immune upregulation of sequentially unburdening her immune system, allowing her immune system to become more, stronger in its ability to handle its infections. So then the next thing we found on the weakness was, scrolling down, a weakness in the brain integration reflex. And for that, very simply, we found that it would be supported with OPC synergy. So here we're selecting OPC synergy. We're going to put her on 1 a day in the morning, just a subtle background dosage. It's not a reason that she's come here. It's not our project, but we can strengthen it while we go. And my cheat, the way I cheat, is every time you strengthen any part of the body, you strengthen the whole body. So even if this isn't her primary weakness, we want to go ahead and support that. So then the next reflex we found was her kidney. And so we found her left kidney to be weak. And for that, she tested for a product called Alboplex. And so we put her on Alboplex, taking 2 twice a day. We'll be gentle with her. Normally we go to 3 twice a day. And so we just programmed that into the schedule. We'll look at the schedule in a moment. And with it, there was another product, a co-product, that helped strengthen it. So 2 products strengthen it. She doesn't do well on liquids, so we basically decided to use garlic. And garlic's not widely used for this particular reflex, so it's not listed here. So we just type it in, and it gives us the choice of using garlic forte. And so we take garlic forte and select that. We put it on 1 twice a day, and we're going to probably get an increased cleansing. Garlic has a really, really good ability to cleanse adherent infection off the wall of the urinary tract, especially what's called nanobacterial infection. So this is a way for us to not use a liquid, but to also get the advantage of sort of cleansing the urinary tract. So you'll see here where the mouse is pointing to that it says add a trace. If there were a trace, something to trace it to, we'd click here and it would tell us where did it trace to, what organ. So this is the nice thing about this program, is it prompts you every step of the way. Did it trace? Is there another organ? Can we go down the rabbit hole, as we've been famous for saying? And we're going to go through this all in a little while, in a minute, to teach it. But right now we're live with a patient, so we'll just sort of stay on track with her. So then, next reflex we found was the small intestine. So we're still under the lymph-immune system, so we're checking those points up on either side of the nose and then tracking it down to the localized weakness, in this case the small intestine. And what we found there was a product called dysbiazide, which is really for SIBO type infections. So we click here, the Tracealytics gives us the ability to sort of be prepared for it on our menu. It makes it a little faster for us. So we're going to put her on 2 twice a day. And we're going to caution her that there's a slight tendency towards cleansing that'll happen in this. So we want to watch out for moving our bowels too much. Although what we're doing is we're going to be taking her off of another product that we've used, which has caused her to be sort of moving and cleansing too much. And we're going to convert her to this product, which we think is going to actually firm up and tighten up the bowels. We do believe that there's an underlying microbial infection in the gut, probably protozoal in nature, and so that is possibly what we're dealing with that's creating this irregularity. So we're gonna continue on. We worked on with the next situation was looking at her. Where do we go next? That was that, and her virus. So we went at this point in time down the rabbit hole. We found a tracing on the small intestine which went to virus. So we can scroll down, or we can just type in virus, and there we are. And now it's tracing to virus. What does the virus need? The virus needs, in this case, something called Ultravirex. So it's a really good antiviral product. Let's see if it's listed down here anywhere. Here it is. And saves us entering it. We're going to put her on 2 twice a day. These are aggressive programs we're putting her on. And we're doing that because we really want to try to clear this deep-seated infection, which has run down her CD56 numbers, and so she's got some immune burden that's pretty significant. And then finally, we want to also put her on a really strong form of quercetin, in this case, which is something called Bio-FCTS, nice product from Biotics, which can very much help increase vitamin C function, quercetin, and very, very good again for supporting the immune system. So there's our FCTS. Again, we'll put her on 2 twice a day because she's a lightweight feminine. So we'll just be gentle with her, and away we go. So now we've entered the information that we found today. So we're going to just scroll down to the bottom. I always like to go to the bottom, make sure there's nothing I left untended. Heart, brain, it's all good. She's staying off of her wheat and gluten, off of her cow and milk, and she's staying off of her tomatoes, right? Okay, good. That's good. These are very dedicated people that are getting great results. She's down 6 pounds on a lean woman, which is looking good, and she's recovering her waist, which is not, I mean, I'm excited about it. Are you? Yeah, I mean, it's not, I know it's not your thrill for being here. Your thrill for being here is to get well, get energy, but like, I don't mind being a better woman while you're going through it, right? So yeah, good stuff. So, so now we go to the next screen, and it's going to automatically populate to our schedule. So in our schedule, we're going to review this, and it shows us that she's now been on Simplex S for about 3 months. So we're going to start reducing some of the doses. We're going to take away the 3 twice a day of Simplex F. We're going to cut it back to once a day. Hypothalamus, we're going to cut it back to 2 once a day. The triple EFA, multiple oil, we're going to cut it back to 1 once a day. So this is the completion of 3 months on the glandular upregulation. The bioimmunozyme forte will stay on. The bio-FCTS will stay on at the dosage we found a minute ago. The magnesium, we're going to cut it back to 1 twice a day. And there's a good likelihood that by reducing the magnesium, we'll also see a tendency towards more bowel firmness. We won't see it moving so much. I'm going to stay in the serenity and the coral at nighttime, which helps you to sleep, the daxotrol in the morning, which gives you a sense of well-being. And I think we'll continue with the Vitanox for 1 more month, which is a good phase 2 detoxifier. The Parasite is the product we think that you might have been reacting to, so we'll take you off of that. I'll stay on the rhodiola. We're still on the Hysanol that we've been taking. Allerplex, we're sort of clear on, so we're going to cut that back, leave a bit of like good lung support, good immune support. We'll keep it at 3 once a day. And then we're going to continue with the osteovegan for the bones. Have you noticed that you've had a little bit better posture, that you've been felt a little bit better? Have you noticed that or no? I mean, he's saying yes, but that's because he's watching you like a hawk. How about you? Have you noticed? Do you feel like you sit up at the computer better? Yeah. I mean, this product works really well. You should be noticing some improvement in posture. And so we're staying on the bone complex. The Tribulus is upregulating her testosterone function. We're going to add in this OPC synergy, which will give you a little bit more focus and concentration. We hope we're going to start working on the kidneys with the Alboplex and the garlic. We're going to probably do this for about a month. It's a pretty fast program. And then we're going to do this Dispiazide for the small intestine and the Ultravirex we're going to do as a way of beginning to support these viruses. So again, remember what we're doing? We're doing the sequential immune upregulation. So product after product after product, spectrum after spectrum after spectrum, just going after virus, fungus, yeast, bacteria, you know, protozoal ergo. We're just going after different spectrums of burden, right? And by so doing, we're reducing the overall immune burden and thus, you know, giving you a little bit of a break and boosting your immune system. Okay, that will then result in the immune system becoming more aggressive, and we hope the immune system, by its own capricious volition, going after the inherent stealth infection that's been burdening you for so long. Make sense? This is the plan. And it's working. I mean, you're doing great, but I mean, I just want to keep reiterating the plan so you keep going like, oh, that's what we're on. That's what we're doing. Because you know, for me, it's easy to remember. For you, it's, you know, you got to keep rereading the same text. Okay, so let's talk about what you have left. You've gone through and you've identified what you have left of things. So go back up to the top. This is how I do it at this point in time. It shows what we gave her last time in terms of quantity. Here's what she'll need this time. So she just opened a new Simplex F, which is probably enough for her for the month. And the hypothalamus PMG, she has 1 new one, which is enough. The triple EFA, you have half a bottle, which is enough. I put in the zeros because when it turns it yellow, it helps me know that I've completed that. She's got enough of the bioimmunozyme, which is 3/4 of a bottle. And the bio-FCTS, you just open up a new bottle, you'll need 1 more. So we'll give you 1, so you don't run out of that. It's a really important product. Magnesium, just opened a new one, so that's enough. And the Serenity PM, you have half a bottle, so we'll give you 1 more. And the Coral, you got a bottle and a half, so that's enough. And the Daxotrol, I think you just opened, right? Yeah, so you got lots of that. It's enough for 2 months, pretty much. The Vitanox, you're getting down on that, so we'll give you 1 of those guys. Rhodiola. We're stopping the Parasite. You can return the bottles that are unopened. Okay, that's the product that was bothering you. Okay, I'm pretty sure. And you can text me if that's not the case. The Rhodiola, we'll give you another bottle. You're down to 1/5 of a bottle. And the Hysanol, we're going to continue on. We'll give you 2 bottles because you don't have quite enough to make on that. And then the Allerplex, you got 2/3 of the bottle, which is enough. And the Osteovegan, you got half a bottle. I'm going to still give you some of that because it's getting low. And the Bone Complex, just opened a new one, so we'll give you 1 more. And the Tribulus, just opened a new one, so we'll give you 1 more. Okay, so with the new ones and the old ones included, your total with your discount that we give you 30% off is going to come to $388. And your husband's a little more expensive than you today, which is not the way it should be, right? Okay, I'll see you guys again in a month. Vic, you'll have this up front. Thank you so much for letting me do this with you, okay? Thank you guys, really good, all right? See you soon, all right? And please, Gloria, you text me if you have a challenge with it. Just give that to Vicky, thank you. Okay, so, and now we just, so you've got both of them saved off and Gloria is now saved off, okay? We'll see them both in about a month. Thank you. So, that's done. Now we're going to go back to teaching. So I apologize for doing a little business in there. But I thought you might enjoy being able to see how that works. So now I go back to this at this point in time, and I think it's a really great add-on of this program. I'm going to email it to her, so she's going to have her own email copy. And so away that goes, and tells me that there's been 8,200 emails sent to this program. So that gives me a confirmation number. That's done. And then I go back. I'll always do this for myself because I want an intact sort of schedule left for me. I go back to the schedule, go to the bottom, and I archive a snapshot of the schedule. So I'm going to be able to keep it and remember it for all time. So that's my procedure, and I'm done, and I'm really, really happy with what we just did. Happy with how she did. So let's go back to the program itself, and let's just look through what we're talking about. So go to patients, and we'll come up with a new patient. We'll do this standard process demo patient that is in the program. So in this particular program, there's Josiah's beautiful face. He's the demo. So in this particular program, we would go through the symptom survey evaluation at first. Oops. So we'll go over here. It's hiding for me. There we go. Detailed history. And this is not exactly what we're here to teach tonight, but I thought I would just show it to you. Here's the detailed case history that I'm sort of famous for, and the entire thing going down, listing everything, putting everything on there, hirsutism, checking whatever's going on, putting down the person's weight, everything. It's all in there, blood pressure. All at the bottom. It's really nice. You can list out, any I've had of surgery, allergies I have, diagnosed conditions, comments, recommendations that you've made to them, so the next time you can read those recommendations, check in on it. All their vitals are here for you to be able to look at. Shows you to be able to list any joint pains that are hurting anywhere. I really am enjoying this. It's becoming more and more elaborated for us to have more and more room to be able to take really good information on it. I put their primary concern up here, like what are they after, what are they trying to accomplish, and then how consistent have they been taking their supplements, and if there's any factors that have inhibited them, like say they're 80% consistent because they were traveling for a month. I just put that in there so it helps me keep track of it. It's also very useful later because when they come back on the 4th or 5th visit and they say, I'm not getting the results, you can look back and go, well, it shows that you were only 50% consistent on your first 3 months because you were traveling. They go, oh yeah, that's true. So the better you keep these forms, the better they're there to guide you and to also protect you when the time comes. So then you would go to the bottom of this form. You've now completed it. I always go all the way to the bottom. You can do it at the top if you want. And I go to the next patient screen. You could just save it yourself and then go to the next screen, but it automatically loads into, in my case, system strength analysis, which is the form that I use. So here's the muscle testing. You might want to go have it load into NRT or into some other, form of muscle testing you're doing, but for me it's SSA. So this is an SSA or teach tonight. So we're going to teach you how to do SSA. So at this point in time, what we do with SSA is we start off with doing the balance access point, getting balanced out with a person. That's not in the program here. You would hold your hand positive or negative and negative over top of the left balance access point, which is over top of the heart on the left side, halfway between the sort of the center of the chest and the shoulder. Sort of place about the size of a silver dollar there. That you just put your hand over top positive, hand over top negative, and you should get a positive strong arm on both sides. That gives you access into the system. You now have parity with the system. You're ready to go ahead and start testing away. So the next thing you're going to work on is going further into the system, and I start with the HP axis. So you're just tracking on this program here. I would test the HP axis, which is right between the eyes on the ridge of the nose. And if it was weak, I would push positive here, and it would automatically cue me for the supplement that would strengthen it, which would probably be from this list, Simplex, F or M, but depending on the gender, maybe hypothalamus or hypothalamics. Maybe I would graduate into it slowly. I really like horsetail now. I would check for infections with Virapel and Hisonol. Femco is very important here. Rhodiola is very important here. Rhodiola schizandra, Rhodiola ginseng. So these are the different things. You can see these are the different percentages of times that these things are used by me. Eventually what will happen is these will be the professionally recommended protocols up here, and down here will be the traceolytics, which will tell you what we're sort of using empirically, like from data. But this is the suggested recommendations up here to pick from. So you can click on either side to do that.
Yes,
so then,
right, that's a great, those traceolytics are actually generated every night at midnight based on what all doctors are doing. And those percentages actually, believe it or not, they're actually the percentages of how effective each of those supplements is proven for this specific reflex point. So those percentages show, for example, that so black currant seed oil has proven to be 75% effective over X number of follow-up exams. And so you're getting a real-time view into what all practitioners are discovering across the country to support your clinical rationale with these traceolytics. And it's updated every night at midnight.
Yeah. That is amazing that you've created that. And that was basically Josiah's idea himself to create that. But I mean, it is one of the most exciting things about this program is, one, I mean, I get to see what I'm doing and feeds back to me, and I've never had it quantified before. I've never been able to see it. But two, I get to see what other people are doing, and so it starts letting me start screening there, and it's just, these are ideas. I mean, it doesn't say you do it. You go test the body says you do it, but they're ideas to take to the body. And so a whole bunch of people start using something, it starts climbing to the top, and I go like, hey, a lot of people are doing this, I'm not doing this, how come? So I check it out, and I think this becomes a really, really great way for us to communicate without having to like even text. It's like it's automatically putting us in each other's back pocket. So the other thing that I want to point out here is once you get this loaded, what happens for me, and just because I guess I'm so good with sequences, when it says add trace, it automatically cues me, is there a trace? So what I would do in this, for example, I'd find the strung, I'd try the supplement, it would strengthen, I'd write it down, which automatically populates the schedule. So I'm building the schedule as I go. And then I would go back over here and I would find, okay, that's strong. I would strengthen the HP axis by rubbing down on the front of the body, up on the back of the body, on the polarity that I found. And then at that point in time, I would go and look at if there's a tracing. So then you take all 5 fingers over top of the biocompatibility point, which is over top of the angle of Louis on the manubrium, which is on your chest bone, your sternum. And if that went weak, that would say, oh, there's another trace here. There's something else that's related to the hypothalamus that you have to find here. So like just a minute ago with, Gloria's husband, we found that the hypothalamus traced to a virus. So that, he had the avian bird flu a number of years back, and it's not been well ever since. And so that, probably has significantly affected his limbic system with, cytokine modulation. And so we're probably having to include that to get his HP axis all the way up and functional. So that's what I like about this program, is it's cueing me to consider, is there a trace? If there is a trace, where would it go? Again, in his case, it went to a virus. He had that really bad virus. So you can go check out the virus, put in the virus. Now we've got the virus. What supplement does it need? Okay, what are you going to go use? Cyrutoplus, or what virus, or what antiviral component we need, Immunoplex, and away we go and see what we find. So, I like that. So the next step is you would consider, you found that, you would go back, you would check for positive, negative on master hormonal, which would be half an inch down from the HP axis, positive, negative. It's strong or weak. If it's weak, you would go identify the specific locale that's weak, which organ is weak. So it could be like a pineal, which would be like folic acid, or it could be the new rage, which is the horsetail, which works really well at the pineal. Could be the prostate that tests weak, which in case you're looking at prostate PMG, other zinc products, and see what you find there. So you can just screen down until you find these things. And again, when you find them, the product that you put in, whatever you select, Prostex automatically populates into the schedule, and you're building a schedule as you go. So the next step beyond that is to move down into the lymph immune. So I think all these particular weaknesses are straightforward to you guys. So I mean, you've got the pineal, anterior pituitary, which is on the left side of the head, posterior pituitary, which is on the right side of the head. You've got the thyroid, you've got the thymus, which again is over top of the angle of Louis. You've got the adrenals on the right and left, which is at the front of the axilla on either side. Pancreas, which is directly under the rib on the left side, underneath the left nipple, straight down from the left nipple. The uterus and the prostate are halfway between the umbilicus and the symphysis pubis. The ovaries on the right and left side would be 1 inch up from the groin on either side, and then the testicles on the right and left would be generally tested together, but you could identify right or left testicle, and you're careful not to touch these guys actually, but because everybody goes weak when you touch them. So then we want to work into the next reflex, which is like the lymph immune. So now you're going to go back up to the top of the brain. This is a master reflex, if we recall the teaching of SSA. And so here we would basically say, is it weak on the right, on the left? And if it's weak on the right, it means there's a right-sided lymphatic issue. If it's weak on the left, it means there's a left-sided lymphatic issue. So then you would trace down these particular things. So the sinus reflex, I hope this is useful to you guys as doctors. I'm going to go through each reflex and tell you where it is and what you could, any salient points that might relate to it. So the sinus reflex is right in the middle of the forehead. It's exactly where the pineal reflex is under this particular master reflex, which is the hormonal reflex. So it all depends on where you pick it up. In this case, it's going to be picked up under the lymph immune reflex. So it's in the very middle of the forehead, positive. We go here, we would check out what's before it, and we could do all sorts of things: sinotrol, imiplex, allerplex, thymex, fungolytic issues. Typically in the sinuses, you'll get fungal infections. And so then we can move on to the eye on the right and left side, which is on the zygomatic arch. And then we can look at the eyes right and left. In other words, you touch both zygomatic arches at the same time. And if that goes weak, it tends to more relate to seasonal allergies that can get into the eyes. So then underneath that, we have the head lymph and the head right, which should be right underneath the mandible on the right side and left side. And that would be sort of like where you would see drainage from the ears, the sinuses. And then out of that, we have the special senses. Special sense is exactly underneath the chin, back towards the neck, sort of pushing up directly into the bottom of the tongue, behind the teeth. And that particular place, when that's weak, that represents a lymph structure that drains the special senses. So typically it responds really well to conjuplex, incredibly well. Really important thing to find, especially with people that have migraines and have difficulty with their sinuses and their eyes and their ears. And then we have the tonsillar on the right side and left side, just inside the clavicle on either side at the base of the neck. And then we have the thymus reflex, which is basically, again, over top of the angle of Louis on the manubrium. The lung on the right and left side is in just medial to the ball of the humerus. And so it's sort of in the soft fleshy part. And if it's weak, it'll be tender on either side. So you can check right, and you would add a supplements and check for tracing on that reflex. And then you look at the heart reflex. And the heart reflex is directly in the middle of the chest, or just about an inch down from the thymus reflex. And that particular reflex, when it's weak under this particular lineup, would indicate that there's a burden of infection, usually virus, that's in the heart. So that would be like cataplex AC, and you would trace this. This is very important when you find this, a very important finding to check the heart for infection. Bone marrow is exactly between the nipples on the sternum, and that particular reflex, when it's weak, indicates that you are dealing with some immune burden that's really, really fatiguing the system. Liver was directly under the right nipple, not under the rib, but on the rib, so it's above the abdomen. And then the gallbladder is a little bit medial and inferior to that, underneath the rib in the small fleshy part of the abdomen. And again, that's another place you push positive and away you would go. Some doctors have found the gallbladder to be so involved and liver so involved that they actually test it as a master reflex every time, which is located down here in this other area. So here's the hepatic and the gallbladder master reflexes. Okay, so the going back up to finish off here, the bile duct is around the side. So a lot of people don't know where the bile duct is, but as a reflex, it's on the ribs, straight to the side of the abdomen. So it's not around all the way to the side, but it's sort of just as the abdomen starts to curve backwards, it's on the side. And it'll be really tender if the bile duct is inflamed or irritated. If you go all the way over, not located on these particular charts, but we should include this, if you go all the way over to the side, straight and entirely lateral, sort of straight lateral to the xiphoid process, but on the side of the rib cage, that is a reflex for the pleura. So it'd be right pleura, left side, right side. And when the pleura are weak, you're looking at, you know, tickling sort of coughs, irritations. Really can be very useful place to check. And Standard Process, of course, makes a tremendous product called Bronchifect, which has pleurisy root in it, which is pretty important. Right now, Houston just had a big outbreak of pleurisy where they had to close a school. So then we're looking at the spleen, which is directly underneath the left nipple, but on the ribs, not under the ribs. Of course, the pancreas is a little bit underneath that, an inch below that on the soft, fleshy part of the abdomen. And then you've got the kidneys on the right and left side of the umbilicus on either side. The stomach reflex is right underneath the xiphoid process, 1 inch down, and 1 inch below that is the small intestine reflex. And then we have the right and left and transverse intestinal reflexes. So the right side would be halfway between the umbilicus and the ASIS. Left side would be halfway between the umbilicus and the ASIS. And that's the right and left colon. The transverse colon would be across the top of the abdomen, basically at the level, just a little bit above the small intestine reflex. You have to get used to these where they are. So you have to sort of feel around for them, but you can feel the actual transverse colon in that area. The uterus reflex and prostate, again, is halfway between the umbilicus and the symphysis pubis. Remember, back up here, under the endocrine neurohormonal, it was showing up in the same location, but under a different master reflex, endocrine hormonal. Here it's under the lymphoimmune reflex, and so now it's showing up the uterus or the prostate reflex in that area. Bladder is right at the symphysis pubis, and then we have the left and right inguinal lymph reflexes, which is on the right side and left side of the groin, right at the groin, not up from it the way the ovary would be. We can also test the vagina for vaginitis, and we can test the penis as well for infection that can occur there. Again, you would do these testings usually remotely or surrogately. You wouldn't touch these areas directly yourself. So then we move into master function. So master function, there's lots of different master functions, and I really want to show some of these to you today. Even some of you who have studied system strength analysis, there'll be some new things here for you, which may be helpful. There we go. Taking my supplements still for the day. So the brain integration is a really good way to see if the brain is integrating right and left sides, see if people are having a good time, you know, being able to like think clearly, think of names, numbers, words, remember what they were saying, what did they come in here for, where are my keys, that sort of thing. So it's basically a positive and a negative hand on top of the head, right at the very crown of the head. And if it goes weak on either positive or negative side, you have to consider the fact that the brain may be having trouble communicating across the red nucleus and through the cross-commissarial pathways that integrate right and left brain activity. So this would be a place where you could support it with OPC synergy, Bacopa complex, RNA, inositol, lots of different things, or you could also do cross-crawl patterns and try to strengthen it that way. Remember, when you're doing muscle testing doesn't only say you can use nutrients. That just happens to be, you know, my specialty. There's lots of other ways to strengthen circuits. Indeed, anything you can do to bring energy to a target or to a circuit is going to work. So then we have the neurotransmitter reflex, which is directly at the hairline in the middle of the forehead, or where the hairline used to be, so at the top of the forehead. And when that's weak, we can consider different ways to feed into, building neurotransmitters and all that sort of thing. Minchex is a good way. Cerevan is a great multiple, 4 different amino acids that feed the brain neurotransmitter pattern. So there's lots of different things. St. John's, Neviton, lots of things we can use to modulate the brain function. And so then we have the CNS, which is a new position for you. So this CNS reflex, this is a central nervous system, and it's in the posterior, it's behind the brain, right at the bottom, right underneath the EOP, the external occipital protuberance. And right underneath that is sort of a soft area, which would basically be right at the atlas or the axis. That particular reflex, if that's weak, it suggests that there's a CNS weakness. And for that, you could start looking at neurotrophin. Doesn't have any in here yet because we haven't loaded it up, but neurotrophin, neuroplex, all sorts of things that might be relating to central nervous system function. And something that I've always used a lot of, but I've failed to teach it over many years, is the cerebral spinal fluid, CSF point. So the CSF point is a single finger point, not a flat of the hand. It's a single finger point exactly at the GV20 meridian source point at the top of the head. So when you go to the very top of the head of the crown and test positive or negative, or test positive or negative and tip of the finger at this point, you can find this. If it's weak, it'll be tender, and if it's tender and if it's weak, it usually implies dehydration in the brain, and that's going to affect people's ability to concentrate, to feel clear-minded, and all that sort of thing. And for that, we use a brilliant product. Again, hasn't been loaded yet, but it's CalAmmo. CalAmmo is the most amazing product for supporting and building cerebral spinal fluid. You can check hearing on the right or hearing on the left, and the way you do that is you hold the flat of your hand about an inch away from the ear and the back of your hand about an inch away from the ear on the right and left side. And if that goes weak, there's some really great protocols that you can use. Again, they haven't been loaded yet, but they will be. CalAmmo or Calma Plus, inositol are some really good products that can help hearing and promote hearing. So the ear itself can also test weak, and that's going to be a reflex right in front of the ear, about literally just right at, if you sort of press back up to the ear, you're right there on the side, on either side. If that's weak, it tends to say that the ear itself has a weakness. So now you're looking for immunological or the function of the different bones that are in there. Maybe Ligoplex 2 can be used, ostrophin can be used. Working on infection, clearing it out, can be lots of ways to promote the healthy function of that. So then we're looking at hydration. Hydration is on the tip of the nose, and that reflex relates to something called trace minerals B12. So here's a recommendation. You would go over here and you would click on that, put in your dosage, and away you would go. So this program can tend to accelerate you very quickly through this. Energy reflex is about energy partiality, and so that reflex lies underneath the nose on the lip, above the labia of the lip. So you're right underneath the nose, and when that's weak, it implies B vitamin insufficiency. And so Cataplex B is a remarkable product, Cataplex G, other products from other companies, Max B and D, and Bio B100. There's lots of different B vitamin sources. Sleep on the right and left side. Right side is more of a surface sleep, phase 1, phase 2 sleep, which relates to your ability to get a good quality ability to fall asleep. And then phase deep sleep on the left side relates more to deep phase 3, phase 4 sleep, which has to do with more immune upregulation and the ability to get into a deep and profound rested sleep. So those reflexes, if you found them, you can go check what's available, and you find lots of different recommendations of what you can do to help support those. But especially vitamin G is a great way to increase serotonin. These are really well built out tests. And the sleep reflexes are pretty much unique to system strength analysis. So hair, you can grab the hair and pull on it gently. If it comes out, then it's definitely weak, but shouldn't come out. If it goes weak electronically, then the muscle testing arm will go weak, and that can indicate that the person needs some vitamin G, which is the most amazing product that Royal Lee, created. Works really fast for stopping hair loss. Minerals is a master mineral test. This particular reflex, you take both arms and you put them straight out in front of you, not with the hands touching, so the hands are maybe like 6 inches apart, and you push down on both arms simultaneously. If that is spongy and doesn't lock in, it implies that they're having a master mineral weakness. So then you can have them hold magnesium or organic minerals or potassium or calcium or phosphorus or manganese or any of the different mineral supports. And if they get strong, it implies that that's the product they need. This is a really excellent reflex. A lot of people don't know it. The acid reflex is just slightly following the line of ribs, about an inch to the left of the xiphoid process. And the enzyme reflex is basically the same place. On the other side is another gallbladder reflex. On the right side would be an inch away from the xiphoid, would be a gallbladder reflex. Another gallbladder reflex, not the same as the one that's underneath the rib on the soft part of the flesh. So you can use these as master reflexes to be testing here. The reason there's 2 marks here, acid or enzymes, is because it's really the same reflex, 1 inch away from the xiphoid. But what happens is if it goes weak and it's strengthened with an acid-forming product or an acid-supporting product, then I consider it to be an acid reflex. If it instead strengthens with an enzyme replacement, I consider it to be an enzyme reflex. So it's really the same reflex, but broken out twice, so it helps you to make notes faster. Hemoglobin and blood are basically up at the manubrium again. So the flat of the hand over top of the manubrium at the chest, basically, is going to show you positive or negative if there's a blood weakness. And that would be like chlorophyll, 4-til-B12, that sort of thing. On the other hand, if you want to go about an inch to 2 inches, actually 2 inches to the left, over top of the heart, positive or negative, not point testing, but positive or negative, that will show you a hemoglobin reflex. And that, of course, very useful to promote with Themax, iron tonic, chlorophyll, 4-til-B12, ferrofood. You also can use a great product called Erythropro from Premier Research, but it's currently in back order, but it's a great way to support blood formation. Then we have methylation reflex. So the methylation reflex is directly over the liver, which is underneath the right breast, but it's with positive or negative side of the hand. So it's not a liver point, just put your hand over there, positively the flat of the hand. So these are flat of the hand tests. Hemoglobin, blood, and methylation are flat of the hand tests. If it goes weak, positive or negative, over top of the liver, you're looking at a widespread methylation deficiency in the liver, which is going to imply that they might have a SNP issue, or that you can somehow promote methylation. Great way to do that is with Vitanox. Great way to do that is with other folate products or methylfolate or things that upregulate. You can also, of course, go into things like cruciferous and green food and other ways that upregulate phase 2 detoxification, including garlic, if you want to. So then we have the lung reflex, which in this case would actually be a right and left lung reflex. So Josiah will change that in coming days. And then we have a heart reflex, which is definitely over top of the manubrium again, 1 inch down from the thymus reflex. Gallbladder reflex and the hepatic, which would be the liver again. These would be master reflexes to see if you've got a master weakness, even though it's not infected, as it would show up here if it was infected under the lymphimmune. But down here, it would just say that the organ itself is under burden. Then you have the hiatus, which is basically right at the xiphoid process, right where the 2 ribs meet. If that's weak, it's suggesting that there's a seal problem, a tendency towards reflux. Really effective there would be something like Ligoplex 2. And then we have the stomach reflex, 1 inch underneath that. Really some great protocols for that with all sorts of products. Gastrozyme, which is cabbage, Enzicor, Gastrex, Zypan, BioHPF, Pyloracil. There's just product after product after product that's designed for that upper digestive tract. Really easy to do. And then 1 inch below that is the small intestine reflex, which is getting more and more common because of the events of what's called SIBO, small intestinal bacterial overgrowth. And the we'll go an inch below that, and you're landing up inside the umbilicus. You put your finger in there, and that shows if there's fungal and yeast overgrowth. And then we have an inch below that, underneath the umbilicus, is the viral reflex. So these are located, hiatus at the xiphoid process, an inch below the stomach, an inch below the small intestine, an inch below the fungal reflex, and an inch below the virus. So it just goes down, 1, 2, 3, 4, 5. Then the kidney is on the right and left side of the umbilicus, and that's going to be typically things like Arginex, Alboplex, lots of different things. K-drain is very useful here. You can also find parasites in the pathway, which would be black walnut hulls, parasite, different anti-parasite factors can be useful with that. I find a lot of kidney stuff on a lot of people. Why? Because the kidneys are a pathway of excretion, as is the liver. So it's under constant burden of detoxification, so you've got to constantly consider reinforcing it. If you're going to chronically take care of people, you can't come in and go like, okay, we detox the kidneys, we'll never do that again. Okay, we cleanse the liver, we'll never do that again. These are things that you're going to have to be regular, and you're going to have your techniques show you ways to identify those regular needs. Gut flora. This is a fantastic, unique reflex to system strength analysis. It's halfway between the ASIS and the PSIS. It's in the middle of the gluteus medius muscle. And if you just stick your finger right in there on either side right now, you'll find on one side or the other you might be tender. I'm currently not, which is a good sign. And if you are tender on either side or both sides, it's indicating some degree of gut flora overgrowth. The most amazing product in the frickin' universe is this gut flora complex, which is made by Carrie Bone. Not loaded here as a program yet, but gut flora complex, an enteric-coated product that truly pulls back the real estate from overgrowth and makes it available to proper flora abundance. So it's on the left side, right side. Endomorphic reflex, also unique to system strength analysis, is just above the iliac crest on the right side or the left side. And squeezing here can indicate whether there's a tendency to weakness in the endocrine system that's causing a morphic change and a shape change in the body, which would be that you're starting to develop sort of midways thickening, which can come from the adrenal glands overworking. And so then the bone reflex indicates that there's weakness in the bone, and that is, there's two ways to do that. You can hold the arms straight out to the side from the body with the thumbs pointing down and push down. That the person really can't hold that up. If it's just real spongy or weak or just failing or quivering, then that indicates bone weakness. Now you can confirm that at the spinal protuberance or prominence, spinal prominence at basically T1, T2. You can just go back up there and you can test, and if it's sort of like prominent and weak, you can test positive or negative. It goes weak, and if you press there, you'll find it to be really tender, and that's where you're going to first see the signs of bone compression, which is what this is all about, is the fact that the bones are beginning to lose their integrity and become compressive. So we can find that there. Then 1 inch, or not 1 inch, then we can go to the grip on bone hormonal, and we can grab people's grips, and if we can open their hands, like the fellow that was just here, Steve, he now, when he first came, he couldn't hold his hand closed, and now at this point in time, he's able to hold his hand closed quite easily because he's been on Cataplex F tablets 3 twice a day for the last 2-3 months, and he's totally built up that hormonal ability to carry calcium, which means he can get calcium into the tissues, which means he's going to have strength. And then we have the right and left skeletal reflex, which is on the posterior part of the body at the very tip of the scapula. If that's weak on either side, it indicates there's a skeletal weakness. And typically you'll find it'll go weak on the right side if you have a right-sided ankle sprain, or a left side. And that can be a great way for us to know what to treat. Usually a remarkable product is, of course, Ligoplex 2 in that regard. Osteovegan, which is marine-sourced algae. There's vitamin F. Of course, vitamin D3, emulsified vitamin D3. These are also great ways to be able to accomplish it. And then finally, we have the bladder suspension reflex. So this is another new reflex to a lot of people. Bladder suspension basically means that you're having trouble with the bladder beginning to prolapse, common in a lot of post-pregnancy women. And where that is right over top of the S2 tubercle on top of the sacrum. So if you test there positive or negative and it goes weak, it means that the person's bladder is having trouble being suspended. And again, really remarkable product, good complex product, that one of the best formulas that Royally put together is Ligoplex 2. Can be very useful to begin to treat that. So I find pretty good success with being able to fix prolapses without having to go to surgery. Then the next reflex is cardiovascular. So before we get into any of the cardiovascular, you can test individually a master heart reflex. So sometimes my patients come in and there's a little alarm. They just got finished with their cardiologist or something like that. And they said, "Do you think I'm having a heart weakness?" And they would just really want to know. So comprehensively, to test the heart, you take both hands, clasp them together, put them straight out in front of the body, just the way we had before for the master mineral, except this time the hands are clasped together, and you push down. If the person can't hold that up, there's some form of weakness in the heart system. We're just not sure where. So you can test that. If it goes weak, it's a master reflex. Then you want to go and find the heart over in the manubrium, which is right in the center of the chest, 1 inch below the thymus that we talked about. The heart valves, which is around the wrist on either side. And you would just put your hands over top of that wrist in whatever way, direction. And if it goes weak, you're looking at an energetic insufficiency relating to heart valve function. Then you're looking at the brain insufficiency, which would be basically on either side of the brain, so feeding the brain. So these would be just below the carotid sinuses on either side of the brain. And then we're looking for lower sufficiency or claudication reflexes, which would be medial to the quadriceps femoris and lateral to the medial vastus medialis, right in where you would feel for the femoral pulse. If that were to go weak, you could suspect, peripheral artery type occlusions. And then you've got the pressure reflex on either side of the body, which is basically right in the middle of the biceps on either side. So you can check that on either arm, on right and left side. And so if that goes weak, you're looking at some sort of pressure modulation. And then a really, really good reflex is basically right over the third intercostal space on the left side. And if that's weak, you're looking at potential of circulation issues or conductivity issues. And you can pretty much find that weak and identify what it relates to by what products strengthen it. So if garlic and cayenne strengthen it, it probably indicates circulation issues. And if B vitamins strengthen it, it probably indicates conductivity issues. So you can test organic minerals, B vitamins, whatever you want. You can also test general muscle strengthening, like with cardiotrophin or cardioplus vasculin, and see if you can get that area to be stronger. And then, of course, we have the 5 brain system, where you take all 5 fingers, put it over top of the neurotransmitter point, which is where the hairline is or used to be. And if that goes weak, it implies some weakness contained in the brain. So then we're going to go localize the cingulate, prefrontal cortex, deep limbic, basal ganglia, and temporal reflexes. The cingulate, again, would be right at the GV20 meridian. And you would only find that after you found the master 5 brain weakness, rubbing down with all 5 fingers. Away you go. Now again, look at the cool thing here. We find the master 5 brain. Are there any products to give for it? Is it traced to anywhere? Where is it traced to? Maybe the thyroid is also making the brain weak. Very common. So then you would push the thyroid, and you would come back here and say, what product strengthens the thyroid? Well, maybe like thiotrophin or some thyroid product that would really, really make a difference with that. So this is very easy to find. Then you would, after you found that, you would go check cingulate, prefrontal cortex, and if you found some other place, deep limbic, you'd go and find out, okay, what do we need to support that area? Simplex, hypothalamus, whatever it takes. And as well, we would also then trace that. So after you strengthen an area, you always, always, always come back with all 5 fingers to the angle of Louis on the manubrium and put your 5 fingers there. And that says, is there another circuit to trace on this? Every time, that's the last time. And when that test's strong, the body's saying, done, I have nothing else to show you. I'm not going to show you anything else. Otherwise, it's saying, here, I'm going to give you another thing to consider. Okay, and it's building a concept for you. The basal ganglia are on the back of the brain, back of the skull, at the base, basically over top of the occiput on the right, the occiput on the left. And the deep limbic is exactly at the HV axis, right between the eyes on the bridge of the nose. Prefrontal cortex is a single point reflex over top of the neurotransmitter reflex on the top of the forehead. And the cingulate system, I've told you, is on the top. And then the temporal system is on either side of the brain, just above the ear, about maybe half an inch, and just forward from the ear on either side. And that particular place is the temporal lobe right, temporal lobe left. And then down below here, we have food sensitivities that you can check whenever you want to. I sometimes screen on the first visit, often I don't. But you check through and you would find gluten, you'd find milk, and it would automatically read out and puts together on their schedule so they know what to do. So my patients really want me to keep track of this. This is getting more and more extensive. Under nut types, we can check for pecans, cashews, macadamians, whatever we're going to check for. And it can allow us to really check that. And you can see over here something new that Josiah has just added, which is a really incredible feature, is the entire nutritional schedule from the last appointment shows up here where you're constantly looking at it. So you can always see what they're taking and be able to say, oh, okay. And that just screams with you through every study you do. So even the detailed case history shows you what they've been taking. So you can intelligently say, oh, you've been taking AC carbamide. Have you felt a little bit more energy? Have you been urinating a little bit more? Did you find yourself getting rid of some of the fluid that exists on your body? And so you can constantly reference back, or what I call pin the tail on the supplement, by being able to see these things over here on the side. This is turning from a Cadillac into a Bugatti, this particular software. It's pretty amazing what's happening. And Josiah is genius at developing it. He's recently added a new module to this for those of you that are interested, which will allow you to schedule your patient. And so that puts you into a schedule, where you can put the patient's schedule in here, and automatically it will give you text and email reminders and phone reminders if you want to program those things in. So this is beginning to take over for Slate and other particular scheduling systems that are available. It's pretty cool. So back again to this, finally at the bottom, we would put down if there are any specific toxins, metals, infections, or infestations that we've found. There's ways to scan the lab studies that we do into this software, and to be able to see what that is, attach it to it, and have to be part of this electronic file, which, I couldn't be more excited for the way this is all working. Then you would come down here and you would save this, and like we said, it would move on into the next screen, which would basically get you ready to tell the person, continue this, stop this, take this, and here's your price, and here's how many bottles you want. And I pretty much, some people choose to have their staff find out how many bottles the people need. I pretty much do it with the patient myself, and I submit it. Part of my concept has always been in practice to have a low diagnostic initiative, to not create a lot of staff needing to support me. So I try to do a lot of things myself. This software certainly makes it possible for me to do that. And I think that's part of why I get a lot of compliance with my patients, is because they feel like I'm personally looking after what they need. Sure, you could see a person shorter and less time, and they could just become part of your machine, but I think they sometimes like to feel a little bit more personalized, and like you're spending time with them. So on the other side of the coin, if you had all these other things done for you, you might just have more time to be able to talk to them about the changes and about the process that they're in, which is very meaningful. So that tells you, you can see up here an example of a tracing, where there's a tracing here as it relates to Biodopolis. There's a tracing here with Thymex. And so it shows you how tracing shows up. And then, of course, this prints out. With the schedule doesn't look like this, is the way it looks like to the doctor who's constructing it. So when you're ready to actually print out the schedule, you can go, this is where I go to, basically in here, I go to print the schedule as a PDF. It creates a really nice PDF of the schedule, which is really great. It also shows the different supplements that they're taking. They can read what they're taking, and it also emails this to them. And my patients love this. They just love it. They ask for it. They like to show it to their family. This is extremely legitimizing compared to the old handwritten schedule that I did, 320,000 times in my career. So I just really, really love how professional this makes me look. And of course, up here it's got my phone number and the name of the office. So it's it's pretty nice. And my patients are able to come back and order their own products and call in, and it's very nice. So I think that's sort of my initial survey. What I want to sort of promote to you guys who are listening and hanging in there for this is that I'm intending to continue to build out, and it's not any limitation on Josiah's part, it's me getting the written material finished. But I'm really intending to put down specific, because for me it's really simple. If you found a weakness in the cerebral spinal fluid, it's simple. You put people on 3 twice a day of Calamo. So I want to get all those protocols down. For me, if their left ear is weak, you would automatically consider Calamo Plus, inositol, Thiamex, Thymus, PMG, Conjuplex, and away you go. So I mean, I feel it's very easy to write things down. I want to convey these protocols. I think it'll be very valuable to you. It's sort of as valuable to me as what originally came from Dr. Bersendahl when he taught me, which was from his pink book and his different books that he came out with that would allow you to be able to see what his protocols and recommendations were. Really, to me, it brought the product line alive, and it allowed me to learn the product line because I sort of had an idea of what I should do and how it would work. And it was my experience with that really made me sort of climb into standard process and other companies as well as I did. So I don't know if we can do, yeah, go ahead, Josiah.
I'm very excited to add those protocols as well. I think that'll be a great benefit to the doctors that are using this, practitioners. I also wanted to let you know, Dr. White, that we do have a number of questions that people have written in. So when you're ready, I'd like to throw some of these your way.
Go.
One of the questions that I have has somebody asking if you can explain tracing, how you follow it. Which points would you test if the angle of Louis went weak? Yeah.
Okay, so let's go back. That's a good idea. So let's go do that. That's a great idea. Let's go back to this schedule that we have before this system strength analysis. So I'll put it up on the screen here. And something we didn't explain here at the very front of the form, it shows that there's tracing A, B, C, D, E. What are they? What we found in the process is that we were doing the whole study, and then down here at the bottom we had all these tracing mechanisms, okay? But what we started to find is that we could trace things immediately rather than afterwards. So we started putting them at the top of the form. So tracing A would be anything at all you want to start with. Now I've taught before that there are 6 entry points to tracing. So it could be a core belief, I think I'm not a good person. And you could trace that and see if it traces into something. And I'll explain to you how to trace that in a second. You could find that they have psoriasis, and you could start with psoriasis as an idea. 5 fingers over top of the angle of Louis. And if it goes weak on psoriasis, the body's saying, I'm going to show you some circuits that relate to psoriasis. Or you could go right off and test their Lyme disease, which is, where would you have a reflex for Lyme? You don't know what to do for Lyme, so how do you get into the system? So you would just come in there, you put your 5 fingers together over top of the angle of Louis, say the word Lyme, think of Lyme, have the patient think of it. If it goes weak, the body's saying, I'm going to show you some circuits that relate to the Lyme disease. Now, once you have a weakness at the angle of Louis with 5 fingers over top of it, held together, then that says there's something to trace. So now what you do is you take all 5 fingers, you rub down on that reflex, okay? And then you test and it's strong, and now it's saying go find the circuit. So the way you find the circuit is you test over the top quadrant, it's the head, over the middle quadrant, which is the top of the chest, the lower neck, over the bottom middle quadrant, which is over top of the stomach, small intestine, liver, gallbladder, and then over the bottom quadrant, which is over top of the umbilicus. Then when one of those quadrants goes weak, the body's saying, look in this area, look in this area. So then you go look for, is it the kidneys? Is it the colon? Is it the viral point? Is it the fungal point? Is it the, prostate? Is it the, gout reflex? I mean, what are the different, places that are located here to find? And then when you find that weak, you find some nutrition to strengthen it. All of this, of course, is written down. So we'll just do some examples here. So let's say we started off here with psoriasis. And so then we found that it was weak, so it traced to the, we went to the lower quadrant. So now we're in the lower quadrant, and what do we find down in the lower quadrant? Let's say we found the, let's say the left colon. Okay, so we just type it in, left colon, descending colon, click. So now here we have it's tracing, psoriasis is tracing the left colon. And so now we're going to go over here and we're going to ask, what supplement do we need to use? So we find the supplement for the left colon, and we start with, like, say, black walnut hulls. We really want to kick out some parasites and other forms of microbial infection. We put them on 1 teaspoon twice a day, put down the teaspoon over here so they know what to take. And we give them a bottle of it, we add it to the schedule, and away we go. Okay? So then it goes back up, and it says, are you done? You strengthen that reflex. Is there anything else to find? No, we don't need to find any more supplements. But is that finished? So we go, now we strengthen that colon reflex, here we are, and we go back up to the angle of Louis, and we test again. Is the psoriasis strong? Psoriasis again. It goes weak again, so it says trace it again. Go find another reflex. Now it's testing to the prostate. So it goes to the prostate, you find out what's going to help with that. It turns out to be Prostex. You put them on maybe 3 twice a day of Prostex, which would be a really beefy way of increasing alkaline phosphatase, which gets a lot of nutrition. Put them on maybe like 2 bottles of it for a month, add it to the schedule, and you're done. So now we strengthen the prostate, go back up to the angle of Louis again, test again for psoriasis. Now it's strong. The body's saying done. I'm not going to tell you anything else about psoriasis. You're done. I've shown you the circuits I want you to know. So then we go down. I just want you to see how like Ferrari this program is. It's better than Cadillac. So then you go over to the program, and you've added these programs, and it shows system strength muscle, or SSA muscle test showed that psoriasis traced to the left colon requiring this product. So now the product itself has this signature on it of telling you why you employed this product and where it came from. And then the dosage is here, including the teaspoon over here that they're going to take. And so then it traced the second time, psoriasis traced to the prostate. So now you've got a record, in this case, of what you did. So next time you come back, you go back and you check those reflexes. They're strong now. We can get off those products, or we continue, whatever. And then you check again, psoriasis. Well, now where it's showing to you. And with something like psoriasis, you're going to get like event after event after event to be able to get it to clear. It's not going to clear quickly. So anyway, I hope that's...
I've got a question that came in here. Can you explain where the special senses point is again?
Yeah. So it's, if you go to the chin, right on the tip of your chinny chin, and move 1 inch back behind the jaw into, as if you were pushing up, you'd be pushing up into the bottom of the tongue. That's the special senses point. So you're in front of the Adam's apple, and you're in front of the hyoid bone, but you're behind the chin. Okay, so it's underneath the chin. It's soft and fleshy. There's no bone there. Okay.
All right. Did you say that the trace minerals B12 is Lee's best product, especially for hair loss?
I said the best product for hair loss is Cataplex G, as in George, but the trace minerals B12 is probably one of his most remarkable products for lots of things, but especially for dehydration, especially for balancing. When I find a person that needs trace minerals B12, they almost always are anxious, and they confirm it. I ask them, are you a little bit anxious? They go, yeah. And even though some of them look so calm, but inside they're paddling like hell, because they, under the surface, are really like stressed. So, I think you'll find that to be the case with that. It's a really good product.
Excellent. I've got a couple practice-related questions here that kind of bridge the gap between SSA and your practice. The first one here is, how do you figure the bottles needed when going through with every patient, I believe it is? In other words, how does he know how much of a bottle is left?
Okay, so that's become second nature to me. Like, I really know exactly how many bottles. Like Thiamex taking 5 twice a day takes 3 bottles to last a month. But The nice thing about the program that Josiah has created is it automatically will calculate the bottles, and you can put in. See at the bottom right here what we're looking at, right here at the very bottom, right above the red archive a snapshot. It says revisit in 4 weeks. If I change that to 8 weeks, it would change all of the recommendations of how many bottles are needed. And you can turn on this feature, which will automatically populate what you need. Go ahead.
So basically, Dr. White, when you don't use this program, you just figure the number of bottles manually?
Yeah. If you don't use the program, you just figure it out manually yourself. What I will recommend, as it relates to practice management, is that you try to get people to purchase a month's supply. You will find that the primary engine of success in your practice is compliance with the dosages. If they take their dosages, but they stop them for 3 days while it takes some time to get to the office because they ran out on a Friday, the office is closed, they had to wait till Monday. I mean, whatever it is, especially in big cities. God bless. It's not like, it's so simple living in a small city, but in a big city, it's so complex sometimes to get over and get your stuff. Like in Houston right now, we're having this rodeo, which, literally they were riding horses, like long parade of horses through the city, and they actually closed the interstates. Like, are you kidding me? So anyway, it's tricky for people to get their products if they don't get it all at once. And if they get it all at once, they're more likely to stay on it and be compliant. And that's what's going to increase your results and your success. So you got to create some sort of incentive for that. I've always incentivized my patients by giving them a significant discount to purchase all at once.
Speaking of discounts, we actually have a question related specifically to that. The person writing in says, do you discount the supplements for all of your patients? Can you explain your philosophy on this?
Well, my philosophy on this is simple, that basically it's America, and after about 2 or 3 months, maybe 4 months at the most, people are going to start Googling the products, and they're going to find out if they can get them elsewhere for cheaper. So you're automatically in competition. Maybe not with standard process, maybe with standard process, but certainly with products that are not as controlled as standard process is. So as a result, I find it very awkward to have patients come to me and say, I can get this product cheaper elsewhere. And then for me to say, well, I'd be happy to match that price. I don't like the feeling of that. It doesn't make me feel professional, but some people do feel okay about that. I don't. So what I'd rather do is beat them to the punch. I want to create some degree of patron loyalty, so that they basically say, hey, listen, this guy's giving me 20% off. I can't find a that price anywhere else. I'm going to constantly use him. I've had people come back even after 5, 6, 10 years later, and they've said, they came back to me and they're ready to work, and they've said magic words, I'll still get the discount you used to give me, right? And it's because I created loyalty. Just like if you bought a Mercedes and somebody gave you $5,000 off the sticker price, you're going to buy your next Mercedes from the same person. So that's my philosophy. It's America. America works. Very, 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 very few things in America pay full retail price. That's why we live with Costco. We live with Sam's. We live with Walmart. We live with Amazon. I mean, this is what drives the industry. I don't know why we're so slow to get to it in the medical profession, and why we're so slow to get to it in the nutrient profession. But I'm going to promote to you that if you don't take care of creating that product loyalty and patron loyalty, you're going to have what's called the backdoor leak, which is they come in the front door, they get results, they realize it, and they go out the back door and they find it less expensive elsewhere. And you would do the exact same. You might not do it for 5% different, but if you could find it 10% different or 20% different, you would buy it elsewhere. So I mean, that's just the way it is. I'm currently purchasing some jewelry, and we found it half price someplace else. So guess where we're going to buy it? So
2 more questions relating to SSA.
Go ahead.
Directly.
Yeah.
First of all, for the master lymph point, do you not test any supplements for that? It just indicates to you whether you should go down the right or left side of the body in the lymph points. Is that right?
That is correct. And you could see, muscle testing is a language. There's lots of variations of it. You could go to those master reflex points and never differentiate them into a locus and just test every single product right at that point, and it would work. Just like you can test all the different products at the master brain point. rather than differentiated into temporal, limbic, cingulate system. So you can use the master points to just test right there, or you can like differentiate through it.
Excellent.
Same thing with tracing. You can treat, like you could test for psoriasis over top of the manubrium, and you don't have to go and like find a locale for it. You can just test right there. There it is. Do I want to test something that's anti-parasitic? Do I want to test something that's antifungal? You can just test right there. Go ahead.
We have about 7 or 8 more minutes that we'll keep accepting questions. So I've got 2 more questions so far that have been written in that I'll ask you. If anybody else has more questions to ask, please write them in now. We're going to aim to be done in about 8 more minutes here. And the next 2 questions that I have for you are still on SSA. Could Dr. White go over the bone point again?
Yeah, that's a really great point. I'm really glad to hear it. And for some of you that have been using the system, you'll see a bunch of beefed up points that have been added on since yesterday, which is thanks to Josiah. So the bone point is, there's 2 things. They're duplicate tests. So one is both arms directly outside the body with the thumbs pointing straight down. So the arms are rotated forward. And then you're pulling down on the arms, which you're basically testing the posterior deltoid muscles. Okay? If that's weak, that is generally indicating a bone weakness. So it's looking at bone metabolism of some sort. Have them hold BIOS, calcifood, go to Cola complex, bone complex, vitamin D, cataplex D. Something is going to strengthen them. The confirming point for that, or you don't even have to use that point, you can just go straight to the other point, is over top of the spinal prominence at the base of the neck, over top of C7, T1, and T2, where there's sort of the spinal processes that stick out there. Now that's where a lot of people develop Dowinger's hump. And when the Dowinger's hump is developed, it becomes very obvious. That is, again, for exactly the same reason. The bones are compressing, and the body is changing its shape, the muscles are splinting, and it's creating that buffalo hump to try to hold it up. So if you test that reflex and it goes weak, positive or negative, that's another way to get in on bone function. You also, after you test that, you can test with your fingertips and touch and press in on that spinal protuberance. And if it's tender, it also implies that you're getting bone compression. And it is exquisitely tender on people that have osteopenia, osteoporosis, and bone compression. And guys, to be honest, for me, like I'm 58 years old, I live on bone support. And when I don't, I start to slump, and also that area gets really tender for me. So the only downside of, well, it's actually the same as it used to be, but the downside of doing this new work with the tablet and doing Nutralysis is now I'm looking down all the time at the tablet. Which is, eventually I got to do something ergonomically about that. I think I'm going to have to lie on my back to do the study. But anyway, but this is where the body takes a lot of wear and tear with the weight of the head at that base of the neck.
And you do have a massive brain there to keep vertical there.
There you go.
I have a question here about sleep reflexes. Where are the sleep reflexes exactly?
Okay, so the sleep reflexes are directly behind the ear on the mastoid. Now, on the mastoid is something called a mastoid notch. So if you guys put your fingers back there right now and feel your mastoid, just going slightly back posterior, you'll find a notch right behind the mastoid. That notch, if it's tender on either side, implies you're having trouble with the gallbladder meridian, which is directly tied into your sleep quality. But that's what you're looking at. The beginning of the gallbladder meridian is right there. And that reflex on the right side is surface sleep. On the left side is deep sleep. So right side is phase 1, phase 2, surface sleep, the ability to fall asleep, get to sleep. And then on the left side is deeper sleep, phase 3, phase 4 sleep.
Excellent. I have a practitioner who writes in and says, I often struggle with correcting the patient's polarity. The strong indicator muscle will stay strong. I was taught this was a switching problem. Can you explain this and how to correct it?
Yeah, I used to do that, and I respect that work, and I don't do that anymore. I just let the patient stay in the polarity they're in, and I don't change it. I used to be taught that you should be able to defeat a person at certain places in the body, and that means they're testable. I changed my view on that. In system strength analysis, I don't teach that. I believe that you should not be able to defeat a person anywhere. When people have entirely strong systems, there's no place that you can defeat them. Otherwise, it's just an issue of balancing your energy with the patient's energy to be able to find where the actual weaknesses are. In that regard, we've taught before something about called prioritization, and a way to intensify prioritization is if you strengthen the body, it will now only show its major weaknesses. And the way you strengthen the body is creating loops of energy that reinforce it. So you can put your fingers, we've taught it before, where you put your middle finger in the first crease of your thumb and you hold it together. You can put your tongue to the top of your mouth and push up there, and it reinforces the energetic pattern of the body. These energetic reinforcements take away a lot of the other secondary weaknesses and leave you just showing the primary weaknesses. So anyway, the concept of switching is not something that I do anymore, but it is, I respect the work of other practitioners who teach that. It's really some very good ideas. But it's in this field. In this field, that's been something that everybody has sort of accepted and gone with. And I'm not sure it's entirely true. I find that people are switched because they're nutritionally deficient, and as soon as you begin to nutritionally feed them, they get really clear and they test really clear. So, thank you.
I've got one more question here. Someone was writing in asking if there is access to a demo or a recording of the system, and we will be sending out, Nutralysis will send out a recording to anybody that has attended and signed up for this webinar. We'll send this out tomorrow, so look for an email from Nutralysis with a recording of this webinar here.
So let me just say, Josiah, one, I want to really applaud Josiah for the tremendous innovations that are going on in this program, and how it's like facilitating learning this program, and learning not just the program but the entire practice management system that we use. But two, I want to just say that if you really want to learn this system, Nutralysis can help. It can sort of be like a training wheels program. But in addition to that, you can go online for doctorthefuture.org, and you can find a system strength analysis packet, for which you can get for $125, which is a self-teach 2-hour DVD, which instructs on how to do it. It's an older DVD, but it does instruct on pretty much 90% of what we just taught tonight. And then you can fill in the other things that are on this. So that's what's starting to come forward. Eventually there will probably be new DVD, instructional DVDs for doing this. And as I've been famous of saying, I believe that this basic, muscle testing system will deliver you to a $200,000 or $300,000 a year nutritional practice within probably 2 to 3 years, because it just is that diverse. It diversifies the practitioner, it diversifies the patient, it allows you to treat lots of different things. And basically muscle testing is learning. So you start off by letting the body tell you, the body tells you the same thing enough times, and you begin to know, like the body knows, what needs to be done for people. And then that accelerates to deeper levels of learning. It's really, I just think it's magical. I think its time has come. I think the public's waking up to it. I think that we have a great, those of us who are interested in doing this have a great timing for ourselves right now in terms of the marketplace. So thank you, Josiah, for the opportunity to present. Thank you, all of you, for being interested. I will continue to try to deliver my life's work to you through this tool and all the tools I can, because I've really got that it's way beyond just my business. It's about really being able to do what has been so meaningful for me, which is to be able to change people's lives at will, and to watch the growth, just like we talked with Kelly tonight. And in one visit with Kelly, in one visit with Kelly, she came in here, and I in one visit I said, Kelly, it's going to be hard for you to know this, but you are going to get so beautiful and so gorgeous and so lit with this program that you are going to have a tendency to give yourself away too easily to the first person that comes along, and I want you to know that. So you're still going to make that mistake, but I want you to know that you have a tendency to give yourself away, and you need to wait for the right person. And so it's just so amazing in a month to be able to have that conversation with her in front of her mother, and they were so excited. And I don't know. I want my life to be full of magic, and I'm glad for Kelly that her life became magic. So, good job tonight, Josiah. Good job for all of you guys. Good luck. I hope we can use this work starting tomorrow morning.
Well, thank you so much, Dr. White, for joining us tonight. We're honored to have you, and thank you so much for sharing your life's work with us here tonight. We look forward to continuing this partnership with you and continuing to provide these types of learning opportunities for our community and our clients at large. Thank you, everybody, for listening in tonight. We'll send you out a recording tomorrow. Everyone, have a wonderful evening. Thank you from everybody here at Nutralysis, and thank you, Dr.
Thank you.
Good night.